Hello everyone, now let us discuss about CPT coding guidelines for anesthesia part 2. This session is a continuation of part 1 session. Here, first let us discuss about how to code multiple procedures. Under the same anesthesia administration, if a surgeon performs multiple procedures, then code only anesthesia to complex procedures. If multiple procedures are performed, we must code anesthesia code only to complex procedures. How will you determine the complexity of a procedure? Higher the base value, higher the complexity. And one more important point is moderate sedation or conscious sedation codes, which come under the range of 99151 to 99159, will never be coded together with anesthesia codes. Never code together the anesthesia code and the moderate sedation or conscious sedation codes. Now coming to anesthesia modifiers. Let us first discuss about physical status modifiers. As the name indicates, these modifiers indicate the physical status of the patient. Physical status modifiers are represented by initial letter P followed by single digit from 1 to 6 and are defined as below. P1 modifier indicates a normal healthy patient. P2 modifier indicates a patient with mild systemic disease. In other words, the patient has stable chronic conditions. Next, P3 modifier indicates a patient with severe systemic disease. In other words, unstable chronic conditions. P4 modifier indicates a patient with severe systemic disease that is a constant threat to life. For example, history of MI, CVA if the patient has end-stage renal disease and is not under dialysis. These clinical examples qualify P4 status. P5 modifier indicates a patient who is not expected to survive without the operation. For example, if the patient has intracranial bleeding or aneurysm, then we indicate it with P5 modifier. Next is P6, a declared brain dead patient whose organs are being removed for donor purposes. For example, if the patient has coma, it is indicated by P6 modifier. These are various physical status modifiers. So these physical status modifiers are consistent with American Society of Anesthesiologists ASA ranking of patient's physical status. These are used to rank the patient's physical status. P1 indicates a healthy patient. P2 modifier indicates patient has stable chronic conditions. P3 modifier indicates unstable chronic conditions. P4 modifier indicates severe systemic disease that is a threat to life. For example, history of MI, CVA and if the patient has ESRD and is not undergoing dialysis. And P5 modifier indicates the patient cannot survive without performing surgery. In such cases, we indicate with P5 modifier. For example, if the patient has intracranial bleeding or aneurysm. These clinical scenarios are represented by P5 modifier. And P6 modifier is indicated to describe brain dead patient or a patient in coma state. Now let us discuss an example. What physical status modifier best describes a patient who has severe systemic disease that is a constant threat to life? The answer is P4. A patient with severe systemic disease that is a constant threat to life. Example is MI, CVA, ESRD not undergoing dialysis. Next example, a 43-year-old patient with severe systemic disease is having surgery to remove an integumentary mass from his neck. What CPT and modifier reported for anesthesia services? First CPT is 00300, anesthesia for all procedures on the integumentary system muscle and nerves of head, neck and posterior trunk, not otherwise specified. And the physical status modifier is indicated with P3. Here the patient has severe systemic disease and is undergoing a surgery. So a patient with severe systemic disease that is indicated by P3 modifier. Next, coming to qualifying circumstances. Usually one or more qualifying circumstances may be selected along with the anesthesia code. Many anesthesia services are provided under particularly difficult circumstances. Note this point. Many anesthesia services are provided under particularly difficult circumstances depending upon various factors, and these circumstances are defined as qualifying circumstances. Some of the examples of qualifying circumstances are: first is unordinary condition of the patient. Next is notable operative conditions. And finally, and or unusual risk factors. These are some of the factors which contribute the qualifying circumstances. One more important point is the qualifying circumstance procedure codes are not reported alone. The qualifying circumstance codes are only add-on codes. They are not reported alone but would be reported as add-on codes for primary anesthesia codes. Now coming to various qualifying circumstance codes. The first one is plus 99100. As we know, the plus sign indicates it is an add-on code. So plus 99100, it indicates the age of the patient. Extreme age. If the patient is younger than 1 year and older than 70 years. If the anesthesia is complicated by extreme age of the patient, that is, patient is less than 1 year and older than 70 years, then you have to use the add-on code plus 99100 as qualifying circumstance. One more important point in reporting these code is, if age is already a part of the code description, do not report it separately. If age is already a part of any code's description, you should not report plus 99100 separately along with that code. For example, if we see 00320, it indicates anesthesia for procedures on esophagus, thyroid, larynx, trachea and lymphatic system of neck, not otherwise specified, age 1 year or older. In this code description itself, age is a part of this description. So while reporting this code, you should not use the add-on code plus 99100. Another qualifying circumstance is plus 99116. It indicates total body hypothermia. If anesthesia is complicated by total body hypothermia, you have to use add-on code plus 99116. And if the anesthesia is complicated by controlled hypotension, you have to report additionally plus 99135. Next, if the anesthesia is complicated by emergency conditions, you have to use add-on code 99140. These are the various qualifying circumstances and their CPTs. Now let us discuss an example. 11 months old patient presented for emergency surgery to repair a severely broken arm after falling from a third-story window. What qualifying circumstance code or codes may be reported in addition to the anesthesia code? Here first, whenever you code anesthesia codes, first we must see the age of the patient. The age of the patient is 11 months old. That is, the age is less than 1 year. So first you have to report, in addition to anesthesia code, you must report first 99100. Anesthesia for patient of extreme age younger than 1 year or older than 70 years. Additionally, this is a emergency surgery to repair a severely broken arm. So this qualifies additionally plus 99140. Anesthesia complicated by emergency conditions. So what is emergency? An emergency is defined as existing when delay in treatment of the patient. An emergency is defined as existing when delay in treatment of the patient would lead to a significant increase in the threat to life or body part. Now coming to general anesthesia modifiers. The various general anesthesia modifiers are 47, 23, 53, 73 and 74. First we'll discuss about modifier 47. This is reported when anesthesia is administered by surgeon. Whenever surgeon administers the anesthesia, you must report modifier 47. And this modifier should not be reported along with anesthesia codes, because in general the anesthesia is usually administered by anesthesiologist or certified registered nurse anesthesiologist CRNA. So only when anesthesia is administered by surgeon you must provide additionally 47 modifier. Next, coming to 23 modifier. It indicates unusual anesthesia service. That is, usually a particular procedure does not require anesthesia. But under certain unusual circumstances, if anesthesia is administered, to indicate that unusual anesthesia service, we give 23 modifier. So 23 modifier should be reported only along with anesthesia codes. Coming to 53. Before anesthesia or before administration of anesthesia or after the administration of anesthesia, if a procedure is terminated, then you give 53 modifier. If the procedure is terminated before or after administration of the anesthesia, we indicate it by 53 modifier, and this is reported only along with surgery codes. And it is used only for physician services. 53 modifier is only used for physician services. Now, next coming to 73 and 74 modifier. They are used for ambulatory surgical centers or daycare centers. They also indicate termination of the procedure, but they are used only for ambulatory surgical centers or daycare centers, and they are used only along with surgery codes. We report 73 modifier if a procedure is terminated before administration of the anesthesia. Before administration of the anesthesia, if the procedure is terminated and the procedure is performed in ambulatory surgical centers or daycare centers, then we give 73 modifier. And if the procedure is terminated after the administration of anesthesia and if the procedure is performed in ambulatory surgical centers or daycare centers, then we give 74 modifier. 73 and 74 modifiers are used only for ambulatory surgical centers or daycare centers. Now let us see an example. 42-year-old patient was undergoing anesthesia in a ASC, ambulatory surgical center, and began having complications prior to administration of anesthesia. The patient began to have complications prior to administration of anesthesia, but a patient was undergoing anesthesia and the surgeon immediately discontinued the planned surgery. So here the procedure is terminated after administration of anesthesia and the procedure is performed in an ambulatory surgical center. So you indicate if the insurance company requires a reported modifier, what modifier is reported. In this case, we report modifier 74. After administration of anesthesia, the procedure is terminated and the procedure is performed in an ambulatory surgical center. Now coming to HCPCS modifiers. First is AA. AA modifier is reported if the anesthesia is given by anesthesiologist. If anesthesia is given by anesthesiologist, you give AA modifier. If the anesthesia is given by surgeon, you give 47 modifier. That is general modifier. Now this is HCPCS modifier. Next is QZ. Anesthesia by CRNA. Whenever anesthesia is administered by CRNA, you give QZ. Anesthesia is administered by anesthesiologist AA. Anesthesia is administered by CRNA, QZ. If monitored anesthesia care is given, you give QS. Monitored anesthesia care is indicated by QS modifier. Anesthesiologist is medically directing CRNA. Here anesthesia is administered by CRNA, but anesthesiologist is medically directing CRNA. Then in such cases you give QX modifier. Next is QY. Here the anesthesiologist is directing CRNA in only one patient case. Anesthesiologist is directing CRNA in only one patient case. You give QY modifier. AD, coming to AD modifier, medical supervision by qualified individual of minimum 2 patient cases. Whenever there is medical supervision for minimum of 2 patient cases, you give AD modifier. And whenever there is medical direction for minimum 2 patient cases, you give QK. You give QK for medical direction and you give AD for medical supervision, and the minimum patient cases must be 2. Now let us discuss some examples. CRNA is personally performing a case with medical direction from an anesthesiologist. What modifier is appropriately reported for CRNA service? Here anesthesiologist is medically directing CRNA, so we give modifier QX. Anesthesiologist is medically directing CRNA. Next example is an anesthesiologist is medically supervising 6 cases concurrently. Medical supervision. We indicate it by AD modifier, medical supervision by a qualified individual of minimum 2 patient cases. Here the patient cases are 6. So you give AD. Finally, an anesthesiologist is medically supervising 6 cases. What modifier is reported for CRNA medically directed service? So here anesthesiologist is medically supervising 6 cases. But anesthesia is administered by CRNA and CRNA is medically directed. So here you give QX. Anesthesiologist is medically directing CRNA. Finally, coming to steps in coding anesthesia. So whenever we code anesthesia, we must take into consideration 6 factors. The first point is we must look for the age of the patient. And the next is you have to look for the procedure performed. You have to look for complete description of the procedure performed. And finally, you have to code anesthesia to the body part where a surgical procedure is performed. Anesthesia codes are categorized based on the body regions. And finally, you have to look for status P modifier. Then you have to check for qualified circumstances if there are any qualifying circumstances. And finally, you need to address if there are any HCPCS modifier. These are the 6 steps that must be taken into consideration before coding anesthesia codes. By this, we complete CPT coding guidelines for anesthesia. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.